Welcome to the EAHAD Physio Committee Meet the Author interview series. I'm your host, Magnus Aspdahl. I'm a physiotherapist working at the Pediatric and Adult Coagulation Center at Karolinska University Hospital in Stockholm, Sweden. And I'm also a member of the EAHAD Physiotherapists Committee. Today we have a special guest, Flora. Flora, please introduce yourself.
Yes, sure. My name is Flora van Leeuwen. I'm a PhD candidate at the Radiology Department of the University Medical Center in Utrecht, the Netherlands. And my research is in collaboration with the Van Creveld Clinic, our hemophilia treatment center, and it focuses on imaging of subclinical joint changes in people with hemophilia. I'm excited to be here today.
Thank you for being here, Flora. So we're here today to talk about your latest research paper titled Monitoring Recovery of Joints After Bleeding. Physical examination and ultrasound are complementary. It's a study that has provided me with valuable insights in my clinical work. So can you tell us a little bit more about your study?
Yes, certainly. So in our study, we investigated the recovery of joints after bleeding. So traditionally, joint bleed recovery is monitored by clinical symptoms such as pain, swelling, and range of motion. But from our own experience and from previous literature, we knew that asymptomatic joints could still show ultrasound abnormalities after a bleed. So therefore, we decided to investigate the joint bleed recovery with both physical examination and ultrasound. So we conducted a retrospective study in joint bleeds of people with hemophilia and von Willebrand's disease, and we followed them up until they were fully recovered using both physical examination and ultrasound. The joints were treated according to the current WFH treatment guidelines and were monitored on set moments in time. So patients were evaluated within 7 days of the onset of the joint bleed, 1 week after their first examination, and thereafter monthly until they were fully recovered.
Okay, that's fascinating. What did your study findings reveal about the duration of the recovery process and the difference between the physical examination and ultrasound?
So we evaluated 30 joint bleeds in 26 patients, and the median recovery time was 1 month, but the recovery times varied widely, so from 0.3 months to 5 months. And in 47% of the joints, the joint bleed recovery took longer than 1 month. We also tried to investigate whether there were risk factors for prolonged recovery, but we could not find any significant differences in recovery times between, for example, different severities of hemophilia, different cases of joint causes of joint bleeding, or different joint types. And so for the second part of the question, so focusing on the discrepancies between physical examination and ultrasound, we saw differences between the physical examination and the ultrasound in 27% of the joints. In 10% of the joints, we saw synovial hypertrophy on ultrasound in joints that were clinically recovered. And in 70% of the joint bleeds, we saw clinical abnormalities when the ultrasound was already recovered. So, yeah.
Okay, thank you for sharing, Flora. So now let me ask you a question about monitoring joint bleeds. While routine monitoring after 1 month sounds essential, do you think we should monitor every joint bleed until they are fully resolved?
Well, yeah, that's an important consideration. I think that monitoring every joint bleed until they are fully recovered, that might provide comprehensive data, but I don't think it's really feasible in clinical practice. So therefore, I would advise monitoring at set intervals. So for example, after 1 month, because I think that if you take the 1 month interval as an example, that moment in time can really differentiate between joints that recover normally and joints with a prolonged recovery. And you can identify them at the early point in time. So for example, if the 1 month evaluation shows that the joint is fully recovered, then obviously you can stop the monitoring there. And if the joint still has abnormalities, then based on that, the healthcare professional can decide that he or she wants to monitor the joint more closely and or change the treatment and the rehabilitation for this patient. So I won't say monitor every joint bleed, but look at set intervals and individualize the monitoring based on that.
I agree. So now let's touch upon the topic return to sports for people with bleeding disorders. When do you believe a person with hemophilia should return to sport after joint bleed? Should we wait for the full recovery or consider a clinically resolved joint bleed, even if there are ultrasound abnormalities?
Well, that's an excellent question again. I think that really depends on the patient and the joint involved. If you know from previous ultrasound examinations that the joint bleed occurred in a healthy joint, so a joint without previous ultrasound abnormalities, then I think finding synovial hypertrophy on ultrasound means that the recovery process is still ongoing. And in those cases, I would advise the patient not to resume his sports yet, because I think that the reactive synovium makes him at risk for a rebleed or chronic synovitis. But we also know that some patients have a residual synovial thickening after previous bleeding that doesn't go away. And in those cases, it's harder to say whether the synovial hypertrophy you see on your ultrasound is still reactive or not. And for those patients, it's harder to make the call based on the ultrasound. So therefore, I would say in general, ultrasound is important in deciding whether someone can return to his sports activities, but the clinical abnormalities still remain important. And obviously, you should also take into account which type of sport you're talking about.
Thank you, Flora. Wise advice, and I fully agree. Thank you for sharing your expertise with us today. And before we conclude, I encourage everyone to read Flora's paper titled Monitoring Recovery of Joints After Bleeding, Physical Examination and Ultrasound are Complementary on the Hemophilia Journal website.
Well, thank you, Magnus, for having me. I really enjoyed discussing our research, and I hope that it contributes to better patient care in the future.